Hi, Nurse Ty here of Baby Moo Well. Welcome to the channel. Go ahead and like, share, subscribe, follow, comment, all the stuff. We're on all the socials. So welcome again. I am here with a wonderful guest. Her name is Ilia Smith, and she is a women's health practitioner midwife. Excited to share with you her wealth of knowledge. She's a practitioner in the DFW area, and she's a rock star. She's a healthcare practitioner. She's an entrepreneur. She's a single mom, and she works out. So she's living life to the best. And without further ado, let's get into it. That's awesome. We both have non-traditional pathways into the nursing community. And
yes,
so I think
especially being from the south side of Chicago, I mean, it's a rough
I'm from the north
area.
Side. I'm in South side.
Excuse me. For y'all don't know, the north side, yes, it's the uppity side. The south side is where you don't want to go if you're a tourist.
Although we're not gonna lie, when I moved to the south side, I was like, what in the world? It was like a whole new, I couldn't believe it was so different from the north side, but we could talk about that later. I don't know.
Yeah, but getting back to what we're talking about, how I went through every single rank. Being from the south side, I went to Bogan High School, and they had a program there that you could become a licensed practical nurse. Some areas of the country will call it a licensed vocational nurse, but in Chicago it is LPN, a licensed practical nurse. And I got my CNA first, so I was a certified nurse assistant. And, that's more of the kind of cleaning up, taking basic vitals, doing the kind of the grunt work of nursing, unfortunately.
That's important. That's an important
part. But it is. Every part of nursing is important because it makes the whole system work. Mm-hmm. Then when I graduated from high school, I also graduated from nursing school, and I became a licensed practical nurse. And I won't forget this. I was making $550 a week. And this is way back.
That was big money right there.
Yes, I was balling out at that point. I mean, this was when did I graduate? 1998. When I graduated. Yeah, so I'm showing my age now.
That's okay.
And and I was making that and going to college, University of Illinois, getting my RN. And then we met at our first RN job, right?
Yes. Yes. So I did not know that not having that many nurses of in one place wasn't the norm. I didn't.
Yes.
So when I started there, there were white nurses. I mean, it was just an amalgamation of everybody. It was such a great.
We had a nice balance there. Yeah. And this was on the south side of Chicago. Yeah. And it was a nice balance. Everybody felt welcome. Mm-hmm. And I really welcomed you because I think I was there a little bit before you. I can't remember how many months difference. Yeah. And then I was still going on to get my master's in nursing. And that took me, another several years. But hey, I was working, living life. What else are you going to do when you're in your 20s, And eventually became a nurse practitioner and I worked for a large healthcare system. And I also worked for a smaller private institution or private office. I'm able to give patients options. And a lot of times providers are not able to do that because they just don't know the local resources. So if providers are a part of your listeners, you all need to know your resources that are in your area to connect the patients with those resources, even if you think they can't pay for it. I remember early in my career, I had a physician tell me, do not ever not offer all the options to a patient, even if you think they can't afford it, because you just never know what they're going to do. They can mortgage their house, they can sell their car, they can do whatever to get that care. But if they never know about that care, how would they even know to do that? So, like I said, every day I try to advocate and inform. So I guess my advocation is through information. and
Mhm.
say, hey, you do have options, and these are your options.
For for pursuing getting the medical care, for what in general or for a specific purpose, for a specific.
For in general, because a lot of my patients, they are, lower income, as you call, kind of marginalized, have a hard time maybe accessing care. And when they come to, they usually have like a plethora of concerns. So when they come to me, they have a lot of concerns that I have to address, one at a time. And depending on the severity of those concerns, some things, yes, I can handle as a nurse practitioner, but some things require a physician, a surgeon that needs to handle those things, and that can get costly, especially if you're underinsured.
That was something that I wanted to ask about, because sometimes I feel like the county hospitals or the public facilities, I feel like they get a bad rap, and I feel like people don't really take advantage of having those types of facilities near to them. As I know, as a nurse, I've seen those types of places, like the like county hospitals and teaching hospitals, where it's more like public a public institution like that.
Yes.
Um,
Uh-huh.
it may not be as frou-frou as you like, but I feel like you get
They get
really
the job
good
done.
care. You can get really good
Yeah,
care, and it's typically it's free or on a sliding scale. And
very true. And
that was something I wanted to ask you about in terms of
it's
not getting
standardized, so everyone gets the same care. It's not because you're white or black or whatever. Everyone gets the same care, and um, that is one reason they do it that way, because they don't want a patient to feel like they're discriminated against
Mhm.
because of their color or maybe the way they talk or whatever. So, I mean, I work for the county system here in Dallas, and I have to say the providers that I work with, they are always trying to advocate for their patients. I mean, I can think of one of my colleagues, she's a Caucasian female, and she will go above and beyond to try to connect that patient with whatever clinic. So yes, you have to go through more steps than you would at like a smaller private office, but at least you're getting the care, and go through the steps. Make sure you make your appointments. A lot of times people are concerned about the wait. But a lot of times they're not realizing that when you're missing an appointment, or patients miss appointments, and that slot is taken, we have to fill in that slot. So we do schedule more patients. Sometimes everybody shows up. Sometimes patients don't show up. For example, in the county system, what we call no-show rate of the patients who make an appointment and then don't show up is about 20 to 30%, depending on where you are. Okay.
Mhm.
Chicago's a little bit higher. I would say when I was in Chicago, it's closer to 30% here. And in Texas, it's closer to that 25, 27% mark. In a private practice where patients will have to pay for not showing up to an appointment, your no-show rate is 1%.
That's a huge difference. That is a huge
Yeah.
difference.
So I always tell my patients, if you can't make an appointment, please cancel, because someone else needs that slot.
But establishing that care.
Yes. So yes, back to your point. Yes, establishing that care, going through the steps to get, whatever you need done. It is a stepwise process, but the care is just as adequate. It's just the volume of people that we serve sometimes makes it seem like it's not so accessible.
Thank you for that. That was very thorough. That kind of goes into the next question of what would you tell new parents? Because I feel like establishing care is like numero uno. Numero uno of what you do for yourself and your baby. But what do you do?
Yes. So it starts even before you get pregnant. If you're out there, you're having sex unprotected, you can get pregnant. Okay. Come in annually for your pap smears, your well woman check to make sure your health is good, because it starts at the basis. Your health needs to be good in order to have a healthy pregnancy. Come in early when you find out you're pregnant, even if you're unsure of your decisions. Come in early. We can talk about options if options need to be discussed, or if not, start your prenatal care early in the pregnancy. Even if you feel like you cannot pay for the visit, we'll work it out for you. Okay? Make your appointments. Your service is excellent because it fills in the gaps. I have to see 20 to 30 patients a day in order to make my salary. I can't spend a lot of time, even though I want to spend and talk with you and become, best girlfriends and all that. Unfortunately, I can't do that in this world that
baby me well.
Right. Yeah. So
get to be your girlfriend.
Exactly. I have time to, and your providers have time to sit and talk with you, via, the FaceTime or Zoom or whatever platform you're using, to answer your questions thoroughly and address those concerns and the anxiety that you may be feeling as a new parent, especially if you're like me. I was a single parent by myself, 2 dogs, moving to a new city. And, it was hard, but I had the knowledge to know where to go and who to call and what I needed to do in order to get that care.
Mm. Okay. What is something that you want the community to know related to your area in the healthcare industry? So you're a women's healthcare practitioner.
Mm-hmm.
So you've given us a whole bunch already. Get your yearly, come in, get your care. But so you've given us a lot already. But is there anything else that we haven't touched on that you would want to share with people?
Yeah, we have touched on a lot. Ask questions. I would have to say ask questions. Even if you think, this is so stupid or whatever, your provider is there to give you answers. And because we are short on time, write it down. Please write it down. Just, when you think of it, you and your partner laying in bed one day, and you're like, oh yeah, I need to ask her that. Get your phone, have a little note. You know how you have the notes?
Yeah.
Have a little sheet where all your notes. As soon as you think of it, write it in your notes, and then you can pull your phone out. We can just go down a list. You have to be concise in our appointments because, unfortunately, I don't have a lot of time.
That's a good tip, though, so that you're prepared and you're not like, oh, what was that I wanted to know again? Wait a minute, what was that? But instead, you can pull it right up and have it right there ready to go. So that even though that time is, it's a condensed 15 minutes, but you can go you can cover a lot of ground.
Yeah, 15 to 20 minutes, I can go over a lot. Plus, I talk fast.
All right. When is a time where you saw an ally get it right? And so you talked with your colleague, but I like a specific kind of, not like specific, we're not going to violate HIPAA, but like.
Yeah, well, I mean, I guess it goes back to that whole example I kind of used earlier, unfortunately, of, that the doctor that basically told me about just educating the patient fully. And a lot of my colleagues will get that right because we take the time, especially as nurse practitioners, we have a little bit more time than physicians to educate the patient and, like you said, get it right. And to seek out resources like Baby Me Well to say, hey, this is a good website for you because I see you're really involved in your care. So seek this person out to answer your questions even more further, and more in depth, because knowing, like I said, your resources is so important for patients because some, they have a lot of questions, and I really want the best outcome for my patients and their babies. So in order to do that, services like yours fill in that gap. So sometimes just asking, well, hey, do you have any outside resources or any other information where I can go to find more information about, childbirth classes, about breastfeeding, about, well, how to care for myself, after I have the baby or even during the pregnancy from, beyond what we have talked about in the office.
Yes, that's all what we do. Thank you. That is all what we do. We help you from conception or preconception all the way to after you've got that baby and working through just all the new emotions and the newness of it all. Kind of acclimated to it. All right.
Yes,
and let's see. I only have one more question, but we can keep talking. But I only have one. What
okay,
let's have a sip. Okay, let's have a sip. What is something people should know about that is not commonly known? So again, you've given a lot of gems already. Know your resources, ask questions, be prepared, make your appointments, all that. What is something that's just not commonly known? Just some, it could be something random.
The importance of a prenatal vitamin with DHA. I'm going to be simple.
Okay.
I'm going to be simple with this answer.
It's simple, but it's simple, but it's so important.
Yes, a prenatal vitamin with, so let's say, you're thinking about having a baby. You already should be taking, as a woman, you already should be taking a multivitamin, vitamin D, because we don't expose enough of our skin to the sun, especially with COVID, more inside and things like that. So vitamin D. So average woman needs anywhere from 2,000 to 5,000 IUs or international units of vitamin D a day. And then if you eat meat, you also need a fish oil that helps your heart health, helps clean out your arteries, makes your heart easier to pump that blood through versus going very slow and sluggish if it's, got a lot of cholesterol in those veins and stuff and arteries. So supplementation is very important. But then, of course, when you're pregnant, the prenatal vitamin with DHA, which is a fish oil. And then you still can continue your vitamin D in pregnancy, but only 2,000 IUs or international units. And that helps, especially if you're a first-time mom, it helps prevent some complications some studies have shown, such as diabetes in pregnancy and high blood pressure. So as you all know, I'm in women's health. So I deal with a lot of pelvic issues, and bacterial infections are very common. And due to protocols, I can only prescribe one type of medication. When sometimes if a woman comes in repeatedly with the same bacteria, there's different bacteria out there in the world, as we all know. And this one particular bacteria is resistant to the medication that I can only prescribe. So if I were to try to prescribe this secondary medication, I would get in trouble.
What if the patient requests it?
Then yes, I can do it.
Okay.
I can. So it is a part of a patient being informed and saying, hey, if this medication, this antibiotic is not working, I need something different. Please do not give me that same medication because it's not working. So that it's important to say those words or ask questions if you don't know what words to say. Well, hey, I've been coming in here 2-3 times with the same infection. Is there something else that can be done? Something as simple as that will open up the channels of communication where I'm able to offer you more options.
That's good information to have so that people can be empowered to know how to get the care that they need.
And it's not just care that they need, but the care that everyone deserves. Here in America, we have this connotation about healthcare being a privilege. Healthcare is a right. And depending on what state you live, if it's a red state or a blue state, I hate to get political on you, but that's my background.
It's hard. That's hard.
Yeah, it's a big difference. In Illinois, the threshold to be on Medicare, or Medicaid, I should say, because Medicaid is where the pregnant women can get, and women of childbearing age can get Medicare. The threshold for income is much higher than here in Texas. I didn't find that out until I was unemployed and pregnant and single and was like, oh my, I need to get some services that my tax dollars have been paying for all these years. So I got on Medicaid, and come to find out, if my income on a two-person, so me and my daughter, I ended up having a daughter, was more than $575 a month, I could not be on Medicaid. And this is here in Texas. Who can live
Wow, that's
500 and right. I mean, come on. Remember I was telling you, I made $550 a week. Who can live on that? So I hate to say it, the political environment, and that's another reason your listeners need to be politically active and vote. And people are like, oh, my vote doesn't matter, this and that. It does, especially on level, and who is your governor who's making these decisions about the state healthcare, because healthcare is state dependent. People think it's federal. It's not. It's state. Each state has a different threshold. Illinois, for example, I don't know the exact numbers, but it's thousands of dollars that you have to be under. Not a couple hundred. That's a huge difference. And that's a blue state versus a red state. So a Democratic state, so that's what they call blue. And then for those who don't know, and then a red state is the Republicans. You can find me on Instagram and Facebook. The name is The Pursuit of Wellness Kitchen for Instagram, and then The Pursuit of Wellness, it's just Pursuit of Wellness for Facebook. And I basically provide whole food, plant-based education for anyone who wants to improve their lifestyle. And I feel like this lifestyle is the best lifestyle that you can live to achieve your optimal health. So, no more fad diets. Yes, you still need to exercise. Okay. I even though I have a crazy life, and I'm working 10, 12 hours a day, 5 to 6 days a week, depending on the week, I still get out there after work with my daughter. I have a 3-year-old, and I run 3 miles. I can do 3 miles in 30 minutes at 41 years old with the stroller. So if I can do it, anybody else can do it. And I look at Michelle Obama and her arm. I'm still trying to get there.
Me too. She inspired me.
Yes, but yes. So I'm open for one-on-ones. I'm not doing the daily teachings anymore, but I am open for the one-on-one teachings. Like I said, pursuitofwellness.org.
Thank you so much, Ilia Smith, women's healthcare practitioner.
Yes, you are more than welcome, Ty, and Baby Me Well.
Yes. Look us up on Baby Me Well, babymewell.com, and all the handles, it's Baby Me Well, and we're here for you. Welcome to the well.